Hi, my name is Alexandra Martinez, and I will be talking about how smoking can, what happens if you smoke and how you can stop. The first thing I will show is a non-smoker's lungs and a smoker's lung. On the left, you'll see that this is a non-smoker's lung because of how white it is, and on the right is the smoker's lungs. The way you could tell that you have smoker's lungs or lung cancer, is basically what it's called, is if you have black, brown, or dark red spots on your lungs or inside your lungs. What happens inside your lungs right here is when the smoke comes down, there is hairs inside your lungs called the cilia. Inside when you smoke, the cilia starts to burn and you will be more vulnerable to sickness. If you have a family member or a friend or a coworker, peer, they may have these symptoms that you may know that they smoke or things. Stinky clothes, they probably smell like smoke, yellow teeth, and sometimes you may notice that their hair is thin and feels like straw. Lung cancer is a form of tissues of the lungs, and usually the cells of the lining of the passage. That's what happens if you do smoke and get hospitalized. These are the ages of people who smoke. You can see by the age of 12 and 13, 2.4%, that's like 2 out of 10 people of preteens smoking. The highest is 41.2%, and that is 21 through 25 years old. There's this guy named John R. Polito who asked, what is the biggest killer of smoking? If you ask yourself, if you say lung cancer, you are wrong. Lung cancer is part of it, but not the big killer. The big killer is circulatory or cardiovascular disease. Cardiovascular disease is the dying muscle of a heart, basically. And, well, it can affect you really badly. Your breath will be slowing down. The nicotine inside your body will take away the oxygen that your heart will need. That includes killing the muscles in your heart. Male and female will have a hard time conceiving children. Mothers who are pregnant will harm their children and or have miscarriages and or have stillborns. Babies who are born from a smoking mother may have asthma in their early childhood, may have lower birth weights, get sick often, and have smaller lungs. Sometimes this does happen. The cigarette will eat your mouth away. But this, I don't even know if that can happen. But I've seen that a million times happen to a lot of people. And one of the symptoms, people can get hairy tongues from smoking. These are the deaths. By the infants caused by smoking, 970% of that is by smoking. There's house fires, that's also as the same disadvantage as the infants. 3,800 secondhand smoke, lung diseases, heart diseases, and cancers. And you can tell by the cancers, there's a lot. This one is the preventable deaths. Smoking is the highest, yet it is still preventable. The way you can prevent from smoking, or just if you're quitting, stop. Just stop. In 1 week of healing process, if you are wanting to stop smoking, versus you stop for a week, you start to feel the cilia in your neck will start to heal, and you will notice that you are breathing better. The month, you will notice you are not as sick as you were before, and the cilia is still healing at the same time, and you are breathing even better. 1 year, you will have half of the chance of getting lung cancer or circulatory disease. The less you smoke, the more chance you'll live, because you might not know what's going to come through to you. Thank you.